So good morning again, everyone. Welcome to this event on this really lovely, sunshiny day in Guyana. Your Excellency, Mrs. Sandra Granger, First Lady of the Cooperative Republic of Guyana, Ms. Patrice Lafleur, Liaison Officer, the United Nations Population Fund, Dr. Edward Green, UN Secretary General, Special Envoy on HIV/AIDS, Ms. Donna Martinez da Costa, and Mr. Adler Bino, co-chairs of the Caribbean Coalition on Sexual and Reproductive Health and Rights, my colleague executive directors from the Caribbean countries, special invitees including other officials from CARICOM, ladies and gentlemen, all members of the media, welcome. It's an honor and pleasure for me to be here this morning in this very special gathering on the occasion of the opening ceremony of this advocacy workshop organized by the Caribbean Coalition on Sexual and Reproductive Health and Rights, or the CCSHRH, quite a long abbreviation that we'll get used to. So the coalition, that is this coalition on sexual and reproductive health and rights. We have another coalition in Guyana, so I say this coalition was founded by family planning associations in the English-speaking Caribbean countries. And this includes, of course, in Guyana, the Guyana Responsible Parenthood Association. It also includes international partners such as the International Planned Parenthood Federation, Western Hemisphere Regional Office, and we have representatives from that office here among us. Welcome to Guyana. We believe that it is imperative for comprehensive sexuality education to be taught in schools and in youth groups, across every sector and spectrum, as this is an essential building block for a person's effective negotiation of his or her life, as sexual being. Our children and youth are denied the right to high quality of age-appropriate sexuality education. So we are working, and through this advocacy workshop, we are seeking to empower ourselves as family planning associations to play a significant role with partners in the advancement of healthy lifestyle, especially of our young people, and in particular, the adolescent population. So we know that sexual and reproductive rights are important and elemental to a good and healthy society. And so we have a lot of work to do and ways to go in this endeavor. And we must tackle every effort. We must make every effort to tackle, the dealing ways of our society. So we can indeed advance our countries to reach the most vulnerable among us in our populations, and those especially who live on a daily basis under a cloud of stigma, discrimination, and also, in many instances, threats to life. So now, as we open this event, with no further ado, I call on Ms. Donna Martinez da Costa to deliver welcoming remarks on the coalition's behalf. Donna is an esteemed sister and co-chair of the Coalition on Sexual and Reproductive Health and Rights. She is the executive director of the Family Planning Association of Trinidad and Tobago and has been there since 1985 and been the executive director since 1999. So quite a long career and like 3 decades of work on sexual and reproductive health and rights in the Caribbean. Donna also co-chairs the Caribbean Vulnerable Communities, and she's the chairperson of the Prevention Subcommittee of the National AIDS Coordinating Committee in Trinidad and Tobago. and is a member of several other multidisciplinary committees, including a technical working committee on sexual and reproductive health appointed by the Ministry of Health of Trinidad and Tobago. Donna, welcome again. You've been here several times in this capacity. Welcome to Guyana. And really, we are happy for your leadership and wisdom on this brave venture of advancing sexual and reproductive health and rights in the Caribbean. Let's give her a big applause.
Thank you very much, Pat. When you see you have those string of things coming after your name, it's time to go. It's time to get out of it. Her Excellency Lady Sandra Granger, First Lady of Guyana. Dr. Edward Green, UN Secretary General and Special Envoy on HIV for the Caribbean. Ms. Patrice Lafleur, Assistant Representative of UNFPA in Guyana. Mr. Derek Springer, Director of PANCAP and a good friend of all the associations in the region. Representatives of Gilead. My colleague and co-chair, Adla Baino. The executive directors and my colleagues from the Caribbean. Other invited guests, members of the media, staff of the GRPA, and volunteers and young people of the GRPA. It is indeed my pleasure to join my colleagues, and particularly Pat, in welcoming you here this morning to the opening of this 3-day advocacy skills training workshop for members of the Caribbean Coalition on Sexual and Reproductive Health and Rights, which is being supported by the International Planned Parenthood Federation Western Hemisphere region, and which is represented by our colleague, Ms. Estelle from the office in New York. Welcome. One of the outcomes of this workshop focuses on building the capacity of the member associations to ensure that we are able to participate fully in regional development issues through enhanced advocacy and policy development skills. This workshop supports the broad vision of CCSRHR to ensure that the people of this region and the organizations that work tirelessly for those on the margins of development will be positively included in policy development. By supporting and advocating for good sexual and reproductive health policies for all the citizens of this region, we have recognized that there is a gap between demands on leaders and their ability to meet those needs. At the same time, our members are concerned that sexual and reproductive health priorities are at risk if we do not seek to strengthen our capacity to respond to the emerging issues that we face and to adapt to fast changing demands. Let me say on the outset, we see our role as participatory and engaging and not combative. It is no secret that the Caribbean sub-region has lagged behind on advocacy around sexual and reproductive health and rights. In addition, Caribbean governments vary widely in the level of policy engagement and resourcing to implement global and regional commitments. As Pat indicated, despite the existence of all the agreements that we've signed on to, there still persists in the region major inequities in relation to sexual and reproductive health. In several Caribbean countries, whereas the age of consent is 16, a young person cannot legally access contraceptives until the age of 18, creating a 2-year gap unprotected by our laws. Meanwhile, our youth are also denied the right to that high-quality sexuality education in schools, which would empower them to make informed decisions regarding their sexuality and prepare them to better manage their later adult lives as parents, partners, and sexual beings. Across the region, persons of different sexual persuasion live their lives under a cloud of stigma and discrimination. These are just a few of the many inequities that will be tackled over time by the coalition, as it seeks to ensure that the sexual and reproductive rights that are agreed on internationally are in fact made real in the lives of the average citizen across the region. Gains made are constantly being eroded at the national and regional levels as opposition to our work, sexual and reproductive health and rights, are well organized and funded. Organizations and individuals supportive of sexual and reproductive health are sparse and working in silos with limited impact. As members of the coalition, we are known for our outstanding work in SRHR and are forces of influence engaging the society in a shift in thinking about the issues of sexual and reproductive rights. We therefore welcome the opportunity to work closely with CARICOM, UNFPA, PANCAP, the First Ladies Network, Gilead, other development agencies, civil society partners, and faith-based organizations on the CGI project, the Clinton Global Initiative Project, Every Caribbean Woman, Every Caribbean Girl. Because the issues this collaborative proposes to address are also the issues that fire us up in our advocacy efforts. Issues of widespread sexual abuse, unacceptable high levels of adolescent pregnancy, lack of age-appropriate gender and culturally sensitive comprehensive sexuality education at all levels of the education system, lack of legal and social protection mechanisms for the prevention of all forms of violence against adolescent girls, and lack of integrated sexual and reproductive health services throughout the Caribbean region. As a starting point, the coalition is currently primarily focused on advocating for the institutionalization of comprehensive sexuality education in schools, an essential building block for a person's effective negotiation of his or her life as a sexual being. The rationale for this prioritization is well-founded. The age of sexual initiation in several Caribbean countries falls between 12, maybe earlier, and 17 years. The adolescent birth rate per 1,000 women aged 15 to 19 in the Caribbean varies considerably across the countries, but is considerably higher than other countries in the middle or high-income categories, which is where, paradoxically, several Caribbean countries are positioned. According to the World Bank 2012 report, the adolescent birth rate globally for middle to high-income countries is 24. Several Caribbean countries, however, compare more closely with the rates of the less developed countries at 53. Adolescent fertility rates vary widely in the Caribbean, ranging from 26 in Turks and Caicos, which is the lowest, to 97 in Guyana, the highest. According to the 2014 World Health Statistics, the average Caribbean adolescent birth rate stands at 65 per 1,000 girls 15 to 19 years old, which compares unfavorably to the global indicator of 49 per 1,000 girls 15 to 19 years old. Unless our youth, who represent the future of our region, are enabled to effectively manage their sexuality, the Caribbean will continue to compromise the potential contribution of its richest resource. CARICOM has acknowledged the importance of tackling this issue with the introduction of an integrated strategic framework for the reduction of adolescent pregnancy in the Caribbean, which was approved at the level of the Council for Human and Social Development, COSOD, in 2014. Equally important is the supporting draft OECS Reproductive Healthcare and Services Bill, which has been under protracted discussions at the level of the OECS. These documents, which seek to address gaps in legislative protections for adolescents, have the potential to significantly reduce the high levels of adolescent fertility in the Caribbean. With its initial focus on advancing the rights of adolescents and the need for supportive laws, protections, and education, the coalition, in addition to advocating for comprehensive sexuality education in schools, will also be pressing for the adoption of the draft OECS bill and for the implementation of the CARICOM integrated framework for the reduction of adolescent pregnancy. The CCSRHR would also like to cultivate the interests of parents, key decision makers, and relevant civil society organizations in understanding the importance of the work being undertaken to individual and national development, and to enlist their active support for this important effort. We look forward to working with every single one of you here today in this room, including the media, who has a very important role to play in carrying our messages correctly to the rest of the citizenry across the region. And therefore, we thank you very much for being here with us at this special opening as we launch our training workshop in advocacy skills. Thank you.
Thank you very much, Donna, for so well laying out the framework for the workshop we are embarking on, and for highlighting critical areas and the urgency for us to move forward to addressing the issue of adolescent pregnancy. So now I would like to call on the Health Outreach Coordinator of GRPA, who works in the Department of Youth, Selena Cloisi, to introduce to us the next speaker, Dr. Karen Gordon-Boyle. Please come forward.
Good morning, everyone. This morning, I have the pleasure to introduce Dr. Karen Boyle. Dr. Boyle is currently the president of the GRPA Board of Directors and is also the Deputy Chief Medical Officer for the Ministry of Public Health. After studying medicine, she started the Eureka Medical Laboratory and Family Clinic in 1995 with her husband. And after that, she completed her master's in public health at Columbia University and her doctorate at the University of the West Indies. She is also a member of the board of directors of the Demerara Mutual Life Company and secretary to the Rotary Club of Guyana Central. On behalf of GRPA, I would like to thank you for your partnership as we continue to work together for a better Guyana. I would like to welcome to the podium Dr. Karen Boyle.
Good morning, everyone, and thank you for that very encouraging introduction. Not seeing her, but Her Excellency, Ms. Sandra Granger, Dr. Edward Green, UN Secretary General, Special Envoy on HIV/AIDS, Ms. Patrice Lafleur, Assistant Representative UNFPA, Mr. Derek Cummings, officials and dignitaries all, members of the media, and all the representative family planning associations of the region. And I know some of these faces. Hello, and it's great to see you here in Guyana. I received a call last week asking me if I would give a few remarks. What I failed to do is to ask her in what capacity she was asking me to do that. It dawned on me last night that I wasn't too clear. And so I'm just going to share a few words with you. One, as a parent, I think you'll all be able to relate to that. But as I wear a few hats, I will bring in some of the Guyanese context into play and allow us to focus on our reality. And you will realize it's not dissimilar to the things that you're experiencing yourselves. And I really welcome the fact that we're bringing you all together to put our heads together to plan and see how best we can advocate for sexual and reproductive health and rights in this part of the world. The Ministry of Public Health promised our nation equity in health, and this would be regardless of which region you were born, where you went to school, where you work, where you play. The strategy to achieving this is through universal health coverage and equity in access to health services. And Guyana has seen an increase in life expectancy at birth from 59 in the 1970s to 65 in 2010. And the last reported figure was 67 for females, 65 for males in 2014. This increase in our life expectancy, though positive, still places us second to last in terms of life expectancy in the Caribbean. And so we cannot get complacent. In fact, it is regarded that once your life expectancy at birth is less than 70, you have a lot of work to do. Anything deaths before that are considered premature. Guyana is experiencing an epidemiological transition, which simply put means that when you look at the burden of diseases and the cause of mortality, we have moved from being predominantly affected by infectious diseases to being more affected and burdened by the chronic diseases and the lifestyle-related diseases. The last figures we have are that over 70% of our deaths, to be exact, 78% of our mortality can be attributed to chronic, non-communicable diseases. And this is what generally you would see with countries that are supposedly progressing or developing. If you were to look at the rest of the breakdown, it's something like about 10% that is due to injuries and violence, and roughly 15% due to infectious diseases. The 2000, and so that's looking at how we are losing some of our population, the mortality breakdown. And so in terms of replacement, they say if you have a fertility rate of over 2, you should be able to at least cope with those deaths. I don't believe that we're factoring there the amount attrition or loss due to emigration. But that's the figure that they've given for replacement. You need about 2 births per woman to be able to have a stable population. Now, in 2009, our fertility rates across regions was 2.4 births per woman in urban settings versus 6 births per woman in interior locations. So if you recall what I said was our mandate was that regardless as to what parts of the country you're born or grow, we must have similar indicators. And so right away we see that we have some disparities in birth rates. In 2014, we saw a closure, I should say, a reduction in the gap between fertility rates among the regions. So the interior locations, the fertility rates for women were 4 births per woman, as against 2.4 births per woman in the urban locations. And the question we have to ask ourselves is, what is the cause? What has caused this closure or reduction in the gap between interior locations and our urban? We don't have definitive answers, but some of the things that we have to consider are movement of populations. So we have not so, for the past 2 or 3 years, we've had a lot of movement from the urban settings to the interior locations for people prospecting, looking for gold, looking for diamonds. So is it that they're taking that culture and that has caused the change in fertility rates? Is it that women living in the interior locations are now having better access to family planning services and sexual reproductive health services? But these are the kind of questions that we have to ask. Is it a reflection of the infiltration of urban values into the Amerindian or indigenous people's culture? And based on the kind of answers we can get to these, we will have to strategize and advocate for the requisite health services to be available. We also recognize in our country that fertility rates decline with wealth. So we have a 4.7 in the poorest quintile as against 1.8 births per woman in the richest quintile. So it's 4.7 to 1.8. When we look at our adolescents, Donna did mention that, yes, Guyana has the highest adolescent pregnancies. Last year alone, 20% of all our births were among adolescents. What we look at the regional variations, once again, regions 1, 7, 8, and 9, which we consider our interior locations, birth rates among adolescents were 3 times higher than that amongst adolescents in the more urban settings. So what about family planning? What about access to sexual and reproductive health services? What we've noticed is that contraceptive use increases with age, increases with educational level, and increases with the number of children already born. We found that 46% of persons who have completed a secondary education would use and access family planning, as against 22% for those who do not have any education. we found that adolescent use of contraceptives in the 2009 demographic health survey, there's 30% of our adolescents were using or accessing, and 30% of our sexually active adolescents were accessing family planning services. However, in the most recent MIC survey, multiple indicator cluster survey, that figure moved from 30% to 13%. So once again, we have to ask ourselves, what are we doing wrong? Now, in terms of our response and the strategy from the ministry standpoint to deal with these disparities, regional disparities, one of our strategies is the use of health information, electronic health information technologies. And I think you would agree with me that this is the era of information. And so we are making inroads with discussions with the Ministry of Communication to ensure that we can leverage from the e-governance initiatives to take internet access into each region, to establish information hubs at the regional and district hospitals. This, we are hoping, would help us take health information to the patient, so that patients who sit with their doctors will have access to the information that's relevant. We'll have electronic medical records that would help doctors be able to track a patient's progress, a patient's health from time to time, and even from region to region. We also recognize that with this technology, with all its benefits, there are challenges, and we have to have policies that will ensure the privacy, security, and confidentiality of patient information. And so even as we're seeking to roll this out, there are efforts to ensure that the policies are there to support it. And likewise, even as the ministry takes on electronic health information systems, we recognize that even in the homes, information is readily available. And that as parents, we also have to be wise and aware of what information is being made available to our children. Parents have a responsibility to ensure that children are provided with a safe, nurturing environment in the home and are protected from the onslaught of stimuli, information in all sorts and all forms. Very recently in Guyana, we had an example of children that were having access to information that was not in a format that we can say is suitable. Good values and morals are not only to be taught by parents, but demonstrated in their own everyday lifestyles. We know that children lose respect for adults who preach one thing and practice another. A parent of school-age children needs to remember that they are no longer the primary source of information for the child that the child is exposed to, and that they also have access to cell phones, that they are influenced by teachers and their peers. In other words, as we're moving into this age of parenting and the realization of the technology that we're being exposed to, parents have to be savvy and wise. First of all, you have to ask your question, if you have a school child, do they need a smartphone? Perhaps they do need a phone, but does it have to be a smart one? And if you're going to purchase or invest in a smartphone, then you have to ensure that you are wiser than the smartphone and your child combined. In other words, if you're paying the bills and your child is under 18, you do have a right and a responsibility to be checking to see what that child is being exposed to, accessing, etc. What sites are they going on? We need to recognize that the children need to have a filter that they can see, or a prism through which they can see all the information and all the things that are coming and bombarding them daily. We have to provide them with the values that will form that basis, or the value system through which they will be able to filter information. These values teach them what is right and what is wrong. These values teach them to have self-esteem. I always recall the Word of God that describes our bodies as a temple. And I figured if more parents used to teach their children about what a temple means, i.e. the connotations that come with that, something that is special, something that is unique, something that is ornate, something that is revered or reverent, something that is worshipped. If we teach our children that they're loved, that they're special, that they're unique, if these are things that are taught to them from a young age, it would help build self-esteem and self-worth. And therefore, when they are challenged when they are separate from us and have to make decisions based on the things that they're exposed to, you would have empowered them with the tools to make the right choices. I would want to just share with you very quickly some information that came from a renowned pediatrician, Dr. Toby Adeye, which kind of reminds us that we must be aware of the fact that even as we say the home is supposed to be the place of nurturing and safety where we protect children, we must also remember that being a responsible parent requires us ensuring that the home is a safe space and a safe place. Being a responsible parent requires us also planning and ensuring that we are in a position to support the provision of these places and spaces for our children. We have found very recently, we had a reminder that children are being exposed to sexual information and have been experimenting and indulging in behaviors that are generally dangerous. Within the home, very often, children have been exposed to what they call the primal scene. The primal scene being exposure to seeing sex by adults. They do not have to necessarily wait until they go to school to be exposed to pornography. So I'm urging parents to recognize these things and understand the role they themselves may be playing in exposing their children too young. Also recognize that we figure the home is supposed to be the safe place, but that has been found to be the most common place where children are being sexually abused and molested by male familiar figures. Very often these could be male cousins, these could be stepfathers, boyfriends of their mother, etc. And unfortunately also fathers and stepfathers. It is important for us to take action. The second most common place where children are abused are in schools, church youth groups where there's trust and little supervision, youth camps, sports, and at sleepovers. I'm highlighting this because I want us to be aware of the fact that these are things that we will have to take in mind when we're considering how to keep children safe and the adolescent health. I would also urge us that as we are advocating for sexual and reproductive health, that we remember that we as parents also have a role in advocating in the school system at PTAs to ensure that we reinstitute the monitoring and supervisory systems. All too often, we have children left unattended in class. We need to attend PTAs to ensure that we have school monitors, school prefects back on the system. And so, as parents, your role is not limited to the home, but also in the school. I want us to remember that we have institutions such as the GRPA and the organizations you yourselves represent that are doing a great job in taking comprehensive sexual and reproductive health education into the schools. Information has to be accurate, holistic, and relevant, and keeping children safe. I'd like to finally say that parenthood is a privilege, and we were all created to be parents, whether we are potential parents or already parents, but it comes with a lifelong responsibility. And as responsible parents, I wish us all well as we advocate for sexual and reproductive health and rights, and I trust that we can rely on each other to do our part in keeping this and the next generation healthy, wealthy, and wise. Thank you.
Coordinator of the Guyana Responsible Parenthood Association. Come, Juliana.
Good morning, everyone. I've been asked to deliver Ms. LaFleur's introduction this morning. I have considered this task a pleasure since I know her personally through the Youth Advisory Group, YAG, under United Nations Population Fund, UNFP. Ms. LaFleur has a Bachelor's of Social Sciences degree majoring in social work from the University of Guyana and a Master's degree in social work specializing in community development and community participation from Dalhousie University in Nova Scotia, Canada. With these qualifications, she was able to work extensively with different organizations, communities, and governments. Her interest in adolescent sexual and reproductive health has made her both an ally to some and mother figure to many. Through UNFPA, she became the key figure in the lives of both present and past YAG members. Her strong guidance and warm presence will be missed by all of us, since this year she will be retiring after serving at UNFPA for 13 years. Please join me in welcoming Ms. LaFleur.
Good morning, everyone. Madam Chairperson, Ms. Pat Bisnott, Executive Director of the Guyana Responsible Parenthood Association, Her Excellency Sandra Granger, First Lady of the Cooperative Republic of Guyana, Dr. Edward Green, United Nations Secretary General Envoy on HIV/AIDS, Executive Directors from the Family Planning Associations in the Caribbean, and I see Belize and Barbados, and our young colleague from Antigua and Barbuda, who's a Guyanese, Adler, who I know since he was little, one of those persons who I admire as he progresses in his career. I want to also recognize Ms. Donna Da Costa Martinez, an old advocate, and not old in age, but old in the work that we have all been doing along the years, and other distinguished guests, members of the media, members of the youth advocacy group from GRPA. At the outset, I would like to congratulate the family planning associations in the Caribbean for the bold step that you have taken to establish the Coalition on Sexual and Reproductive Health and Rights. This initiative is long overdue, since there is need to position sexual and reproductive health squarely in the public domain, and more so at the policy level. The 1994 International Conference on Population and Development articulated a bold vision about the relationships between population, development, and individual well-being. At the ICPD conference, 179 countries adopted a forward-looking 20-year program of action that built on the success of the population, maternal health, and family planning programs of the previous decades, while addressing with a new perspective the needs of the 21st century. The ICPD program of action, sometimes referred to as the Cairo Consensus, was remarkable in its recognition that reproductive health and rights, as well as women's empowerment and gender equality, are cornerstones of population and development programs. The consensus is rooted in principles of human rights and respect for national sovereignty and various religious and cultural backgrounds. Since the ICPD conference, there has been progress, but not at the pace we envisaged, hence the importance of your coalition at this point in time. One key outcome was the universal access to sexual and reproductive health, which was identified as a target under the health goal of the then Millennium Development Goals. Hence, there were programs developed to reduce maternal mortality, improve maternal health, promote family planning and HIV prevention, as well as care initiatives. However, when one analyzes the situation in our countries, we recognize there is still a lot to be done, a lot to be achieved. Previous speakers, Donna, Dr. Boyle, and others, have attested that a lot more needs to be done. In one of UNFPA's publications, Sexual and Reproductive Health for All, Reducing Poverty, Advancing Development, and Protecting Human Rights, the question was asked, how far have we progressed? The authors noted the complexity of sexual and reproductive health, which deals with personal issues, personal decisions, and cultural norms, which are challenging to address, as we all know. in the field in which we work. The 2030 Development Agenda, Sustainable Development Goals, Goal 3, seeks to ensure health and well-being for all at every stage of life is important. The goal addresses all major health priorities, including reproductive health, maternal and child health, communicable, non-communicable, and environmental diseases, universal health coverage and access for all to safe, effective, quality, and affordable medicines and vaccines. It also calls for more research and development, increased health financing, and strengthened capacity of all countries in health risk reduction and management. Goal 3 also addressed preventing unintended pregnancy and reducing adolescent childbearing through universal access to sexual and reproductive health care services, which are critical to further advances in the health of women, children, and adolescents. As I reflected on this, I was doing some cleaning up of my library, and I found a proposal that I had written in 1987 when I worked with the Women's Affairs Bureau that was submitted to UNICEF to address issues of adolescent pregnancy. That's 30 years ago. And as I read it, I said, where have we moved to? We are still in the same place. And I thought this coalition has so much to do because 30 years, look at me now. Imagine where I was at that point in time. Here in the Caribbean, we have the CARICOM Integrated Strategic Framework on Adolescent Pregnancy, which was adopted by COSA, as outlined earlier by Donna Martinez. And this ISF seeks to reduce adolescent pregnancy by 20% in 2019 in the member states, the CARICOM member states. It means we have a lot of work to do. We heard from Dr. Boyle, the data, as well as Donna, and we know that Guyana has the highest incidence, so we have quite a lot of work to do. The overall goal of that framework is to reduce the number of adolescent pregnancies, as I said, but there are 4 key goals which must be addressed, and those goals have to do with what was identified earlier, the importance of sexuality education in the school system, the issue of reducing sexual violence and other gender-based violences among girls, adolescent girls, ensuring that we have social protection mechanisms to take care of them, and also legal reform, which Donna also spoke about. We have the mismatch between age of consent and age of majority, and in many instances, our adolescent girls are unable to access services unless accompanied by an adult at the age of 18, if they're under 18. But they can also consent to having sex at the age of 16. So that in itself poses a huge problem for us. And I'm telling you, I'm so concerned about these issues. The other one has to do with ensuring that there's access to sexual and reproductive health services in the health centers. And for that, we have to continue to lobby. But of course, as our healthcare professionals tell us, the law has to change, first of all, because the healthcare workers do not want to provide that kind of services under the present law. The platform, therefore, has a big role in its advocacy efforts to utilize the ISF on adolescent pregnancy to advocate for those goals to be achieved. I am pleased, however, to say that the Ministry of Public Health here in Guyana has launched its adolescent pregnancy health clinics and parenting initiatives for adolescent mothers, which we are really happy about, Dr. Boyle. It's really a start to ensure that girls are able to access information. In addition, UNFP in 2007 developed and launched the Comprehensive Empowerment Program for Adolescent Mothers in collaboration with an NGO, Women Across Differences, to reduce second and third pregnancy. That program has been quite a success, and we know that the Guyana Responsible Parenthood Association has also started a program for adolescent mothers, and I think we need to have a lot more of those. But I want to say that your advocacy role has to be intense and strategic. And there are a number of areas I would like to suggest where you need to work, and I will soon join you in the field to advocate. First of all, I think we have to understand who our opponents are. There are many, and they're sometimes in a cloud. But we need to understand what they're saying to the people in our communities and how we can counteract what they're saying. And that's where the research and the data collection becomes very important. We have to challenge the traditional norms, values, attitudes to SRH, family planning, and how adolescents are viewed by elders, professionals in the health, education, and human services sectors. Because, you know, at this point in time, Guyana is also focusing on its reintegration policy for girls, adolescent mothers to return to school. But there are some people who would prefer them not to go back into the school system, for us to find alternative programs for them. That is something we have to address, because education is a right for all children. We have to ensure that the social norms around gender, sexuality, and reproduction are understood, and we have to challenge the traditional norms, the traditional values, where SRH cannot be discussed, as Dr. Boyle was saying. Some of these things have to begin at home, but it also has to be taught in schools, and a lot of our teachers are uncomfortable discussing these issues. We have to interact with FBOs, civil society, as well as communities. Community organizations reach people, and we have to use those organizations to disseminate the kind of information that we want to pervade the society. We have to collaborate with the media campaigns to send the requisite relevant messages to the nation. And of course, men and boys. Men and boys, I think, must be involved. We cannot work in sexual and reproductive health without a relationship with men and boys. They are part of the problem, but they're also part of the solution. And I want to say to you that in one of the African countries, UNFPA collaborated with a community to establish what they call a school for husbands. But we can also have schools for men, because they're men first. And we have to start with them, with the boys, to ensure that we can move the agenda, because we can't move the agenda without involving everyone. And educational awareness, issues of gender, issues of negotiating and decision-making skills, especially for women who sometimes lack those skills. And how do we ensure that we build the self-esteem of women? You know, quite recently we have seen some drastic things happening in Guyana, where one woman gave poison to her 3 children, and then she drank that poison because of some challenges with her partner. You know, we have to help our sisters, we have to help our brothers. So this platform offers a new dawn for our region, one which we must all support to ensure that as we evaluate the SDGs periodically, we will also be able to see significant changes in SRH and rights on the Goal 3 and the ISF goals for the reduction of adolescent pregnancy. SRH must become a national priority, and the coalition has to put it in that domain. Thank you very much. Congratulations.
Thank you very much, Patrice, for your strong, encouraging, and energizing words. And we do look forward
to you joining us in our advocacy effort. I think it's really, we are seeing a bright new era for us to advance sexual and reproductive health and rights in the Caribbean. So thanks very much. At this point, we will have our message in drama by the National Drama School, whom I invite to come forward. I think we'll have to move this.
Jesus Christ, Melissa! What time is vomiting? You there vomiting this holy mine? No, mommy. Then my eyes must be deceiving me, because you could never be emptying the tenny with piss in my front yard. I what? Oh, Melissa, I noticed ever since you wearing these big clothes, your face them fat, your breast them plump. If I know right, I would say you pregnant, Melissa. No, mommy. Who is he? Oh, mommy. The man that did that to you. There ain't nobody, mommy. Well, I know that you ain't married. So it got to be somebody. You see, if I work with you, please. Don't mommy please me. It's big on me a plane, but then you're going to get big on my treatment. Why you go inside, pack your things, and come out my house. Go inside.
This story looks familiar to y'all. Young teen, pregnant, mother hurt. All too familiar, eh? Just like that, a young girl pregnant. Melissa had her entire life ahead of her. A life to be educated. A life to live fairly.
You hear what I said? You hear what I said? I want you to come out my house. Two big women can't live in the same place. You gonna find the man that put that bastard baby in your belly. I don't want in my house. Mommy, please. I'm sorry. I'm sorry? It's too late for a sorry, Melissa. What are you gonna do with you and a belly at 14? 14, Melissa? Hey, I ain't encouraging this nonsense. I want you to pack your things and keep walking. Mommy, please. I didn't mean to get pregnant. Oh, Mommy. You mean you didn't mean to get pregnant, eh? Sorry, you're pregnant at 14. Well, you're pitching now. And you're going to have to find somewhere else to pitch, not in this yard. I don't want you here. By the time I come back, I want you gone. You hear what I said, Melissa? I want you gone.
Think about it. If you was Melissa, what you would do? Well, being that naive teenage she was, the only thing left for her to do was to confront the father of that baby.
Melissa, you sure you're pregnant?
Yes. Well, I wasn't too sure at first, but Mommy seems to think so. And I ain't seen my period in 2 months.
Melissa, it could be something you eat or something else you do. I ain't believe you're pregnant.
I am. And Mommy says I have to leave before she comes back home.
How you mean? Me understand.
Pack up my things and go.
And go where, Melissa?
I don't know. It's all feels like a dream. I'm only 14. I don't know anything about having a baby.
But I know about baby, Melissa. One time we do it. One time. How this could have happened to you?
I don't know, man. But maybe you should have used a condom.
John, I tell you right, them to get scratch me skin.
Paul, you need to call your mother so she can come and talk to Mommy.
Call who? This is between you and your mother. Y'all gotta deal with this.
But this child is involved in my life.
So you keeping it?
Should she keep it?
What you gonna do?
What are you gonna do, Melissa?
What are you gonna do? Well, Joy come home the night and she full ricketics. And she beat Melissa. She beat Melissa and she throw her things out. She call Melissa all sorts of nasty names. Now, if you think your mother call you nasty names, well, Melissa's mother beats all. She was hurt because Melissa threw away her entire life by being pregnant at only 14 years old. Melissa, who was at the top of her class. Joy said that she was a disgrace to her life. A cross! Imagine that. Her own mother treats her like that. Well, Melissa said that she was keeping the baby and she wouldn't listen to a word that Joy said. Then Joy called she, "You dirty little wretch!" A dirty wretch? This child, you is not me daughter. You come in me house and bring belly, and then telling me you're keeping it? Or touch me? You is a wicked girl. A wicked little girl. Sometimes we say things out of anger, without thinking of our words or how much hurt they can cause.
Somebody help me! Please, help me.
She will be ignored. She will be called the village dangles, a little skettle. What a little girl like you do with a baby, eh? Because she was not educated about sex before marriage or sex at an early age. And nobody never tells she that the boy might say, let me just put in the head now. Joy knew that Melissa was smart. So at age 14, she thought that she had the word brains. But no, Joy, Melissa needed you. She needed help.
I need help! Someone who will listen to me.
But who?
But who?
There are so many organizations that you can go to. The Guyana Responsible Parenthood Association, the Ministry of Social Protection, they can help you. Also, the Ministry of Health has implemented support groups.
My baby. I can keep it and I can go back to school.
Community parenting support groups. So many women groups you can confide in. So many women willing to lend a helping hand. So go to those groups, Melissa. Share your story. You are going to be a mother. You will need to step up and look at this child.
But I'm only 14. What am I supposed to do with my life?
You can't let that keep you back. Melissa, you can be whatever you want to be. Safe sex is always an option. But if that is the case, you will have to have a family plan.
With the help of these groups, I can go back to school. And they will advise me on how I can raise a healthy baby. And hopefully, this will never happen again.
You're not alone, Melissa. You're never alone when it comes to teenage pregnancy. Girls like Melissa, girls like me, girls like you, together we can share our stories in safe places with women who care, who want to help to see us grow. All it takes is one time without a condom, one time of pure pleasure to change our lives forever. Melissa, come inside before you catch up.
Mommy.
Come inside, Melissa.
Listen, Melissa. I don't want this kind of life for you. But as a mother, it would hurt me to see you go through this battle all alone. This baby is going to be my responsibility. It's just that I was afraid and ashamed. But you know what, daughter? I'm going to teach you about safe sex. I can't be too ignorant to the fact that you're sexually active. I'm going to fix it. I'm going to fix it, Melissa.
All is well.
Well, thank you so much to the National Dance Drama Group. They have brought home to us, I mean, this issue is real. And the question was asked, is it familiar to you, including those from other Caribbean countries? Well, we see how the story turned out, but in lots of instances, it does not turn out that way. And we are seeing the consequences, you know, throughout the Caribbean, you know, on the streets. And those of us who are, you know, working closely with adolescent mothers, often they are, you know, disposed of in many instances. So thank you very much for making that so real and bringing home to us the issue so well. Another round of applause for the group.
I now call on Donna to introduce our next speaker to us.
Thank you very much, Madam Chair. It is really a pleasure for me to introduce a friend of not only the region, but the Caribbean Coalition on Sexual and Reproductive Health and Rights, Dr. John Edward Green, who is currently the UN Secretary General, Special Envoy for HIV in the Caribbean. He is Professor Emeritus, UE, was previously Assistant Secretary General, CARICOM Secretariat, and Senior Advisor, PAHO WHO. At UWI, he was Pro-Vice Chancellor and University Director, Institute of Social and Economic Studies. He has authored 10 books and over 60 articles. He has served on many prestigious boards and is the recipient of numerous awards. He holds a BSc Economics from the London University and a PhD at the University of British Columbia. It is my pleasure to introduce Dr. John Edward Green to bring some remarks to the gathering this morning.
Thank you very much, Donna. And I want to align myself with the chair's remarks and to say that after that drama presentation, I think my words might just be so insignificant, which tells you about the power of edutainment. But First Lady, Sandra Granger, if you would permit me to say all other protocols observed. Colleagues, ladies and gentlemen, it is really my pleasure to bring you greetings on behalf of the new UN Secretary General, Antonio Guterres, who, when he heard that I was coming to a forum on First Ladies and then here, he thought, oh, if my envoys are doing work like this to empower women and girls, you're doing well. So you have the endorsement of the new Secretary General. And in fact, the outgoing Secretary General was also very, very instrumental in pushing the agenda for women and girls. I also want to congratulate the organizers of this Caribbean Coalition on Sexual and Reproductive Health and Rights. I would say that more than ever, we really need this initiative. We need it for reasons that we heard in the presentations of the previous speakers. And I do not need to repeat the dire statistics for this audience. But I would like to say that when what I call teenage and you call adolescent pregnancy rates in the region are the second highest for regions in the world. When teenage pregnancy rates reach as high as you have illustrated, especially for adolescents between 15 and girls between 15 and 19 years, when 3 of the Caribbean countries are in the top 10 of the world with the countries with the highest incidence of domestic violence. And in fact, when we are a region in which child marriage is second only to Central and East Africa, then we need to do something very radical. And in fact, we need to ensure that some of the programs to which the speakers before me referred are expedited with the greatest of urgency. It is imperative, I think, for the coalition to promote preventive and punitive actions, because in many countries of the region, the law reform, such as the sexual offensive legislation, have not really yielded changes on the ground for women, for children, for adolescents. And this is partly due to the fact that the laws are not adequately enforced, and national policies and implementation plans are not adequately funded. So it would seem to me that as the coalition moves forward, it must trigger adequate policies and plans that can make a difference. And to do so, we heard from many of the speakers before me that these must contribute to change of the deeply ingrained social norms regarding traditional masculine and feminine roles. They must contribute to reducing the gender inequalities. They must contribute to increasing norms that would eliminate violence and impunity. But most of all, I think that sometimes we miss the bigger picture, that changes have to come in the context of the overall economic structure dealing with poverty that forces girls into sexual relationships with older men as a survival strategy. And most of all, I think that we must anchor the strategies of the coalition in what I would call adequate protection of human rights. Now, in this respect, rather than go over the issues, we heard from the previous speakers, and I concur, that it is critical that our programs cut across education, economic development, the broader health agenda, gender issues, and also to ensure that they're anchored in schools and community programs. But I think what is sometimes missing from this discussion is the fact that we need to focus on the relationship between the issues of sexual and reproductive health and rights and the issues of the environment in which women are really engaged. We neglect that, and it's part of the 2030 Sustainable Development Goals. Women are more responsive than men to changing their behaviors towards more environmentally friendly practices. And in particular for the Caribbean, this is critical. Countries with higher female parliamentarians or parliamentary representatives are more prone to ratify international environmental treaties, which in effect redounds best in economic development. More than 40% of the pregnancies worldwide are intertwined with lowering rates that increase the productivity of not only women, but of the general economic situation. And as Haiti, data on Haiti would show, that women are 14 times more likely to die in natural disasters than their male counterparts. So it is for this reason that the UN Secretary General in 2014 initiated a flagship program, Every Woman, Every Child. That was Ban Ki-moon. And I'm pleased that I've associated with a Caribbean variation of that program, Every Caribbean Woman, Every Caribbean Child. But I'm also pleased that First Lady Granger is chairing a forum intent on taking the strategies of Every Caribbean Woman, Every Caribbean Child forward, and that the coalition is involved as a catalyst in taking the programs forward. 2 weeks ago in Port of Spain, and here is where partnerships are important for the coalition. In Port of Spain, 2 weeks ago, I was privileged to be part of a consultation which included a group of approximately 60 faith leaders representing all denominations across the 15 territories of the Caribbean, including the voodoo cult. And I'm pleased that Derek Springer is here to concur that the results of that consultation are so important for the mission of this coalition results which demonstrated that faith leaders in their resolution agreed that they would pursue elements of the PANCAP Justice for All program centering on sexual education, sexual reproductive health, and possibly rights. I say possibly because you have to get people to a stage. And it was most important to note, too, that the FBOs, the faith leaders at that conference, resolved to have an engagement between representatives of faith-based organizations and representatives of key populations, men who have sex with men, sex workers, injected drug users, and also youth. Now, that is progress. And that is the progress that I think coalition must build into as it advances in its role towards correcting some of the ills that we achieve. I am pleased that we have in our presence Congresswoman Donna Christian. I should say former, but for me she remains Congresswoman because she was in the trenches in Congress on behalf of sexual and reproductive rights in the Caribbean. And I hope she will also continue to lend her voice in that negotiating theater in the USA. Now more than ever, we need a voice like Donna Christian. And I want to end by saying that as the coalition moves forward, I think it must continue to embrace partners and to understand that not all partners are in the same place at the same time, but must be taken on a mission through information that is concrete. Like the faith-based organizations 2 weeks ago, they have now recognized the importance of science in making judgments about human development. And I think this is the message that is so important as the coalition moves forward. Draw on the science, draw on the information as a basis of helping people to move to another place and to make decisions. And I want to end by saying, over the last 5 years as Special Envoy, I have had the pleasure of engaging with partners like you, faith-based organizations, civil society, parliamentarians, the youth movements, private sector. And I've been fortunate to learn a lesson that I want to leave here as ending. It is a lesson that in order to make a difference to human development, one has to be proximate. And by proximate, I mean grounding with and understanding the needs of the marginalized. But not only that, but of advocating for the human rights for people who are marginalized. Whether it is advocating for access to affordable medicines and treatment, or sexual and reproductive health and rights specifically, as we were discussing, or whether it is championing the causes of people who are key populations, men who have sex with men, sexual workers, whatever it is, I think the ground message and the goal must be leaving no one behind. And I believe the coalition must, if it is to be successful, attempt to fashion programs that would leave no one behind. Thank you very much.
Thank you very much, Dr. Edward Green, for those words. And indeed, that we need that collaboration. We need to work together so that we would leave no one behind, and especially looking at the vulnerable, those who are marginalized, and encouraging us to reach out to all and to recognize that not everyone, is at the same level, and happy to hear about the work with the faith-based organizations. I'm also a minister of religion, Presbyterian pastor, and vice president of the National Council of Churches. And indeed, it's a key. The faith-based communities are very, very important, and it's to work along with the society in advancing sexual and reproductive health and rights. And we know that it's quite a challenge, but I'll tell you, from within the community, it's also, I see a lot of changes and a lot of opening, and so it's about working in partnership with that kind of critical eye. So thanks again very much. At this time, I call on Dennis Glasgow. He is coordinating, he is within the Youth Department of the GRPA and coordinates our comprehensive sexuality education in school program. Dennis, welcome, and he will be doing a spoken word piece, and Dennis and Juliana perhaps also, and after which he will introduce the First Lady. I should add a word of introduction to Dennis, graduate of Bishop's High School, recently graduated high school. He also attended and delivered at the Women's Deliver Conference in Copenhagen and facilitated a session on comprehensive sexuality education that was really well received. So we're really proud of him.
Good morning, everyone. First Lady, special invitees. So yesterday afternoon we were talking about which young member will do this piece, and we had a bit of a misunderstanding, so I had to write something last night. So this is my piece. I have no name for it as yet, so hopefully somebody can help me with that after. So it goes like this. I'm the one with fresh young blood in my teenage veins. My life, like yours, isn't perfect. We've all got pain, but I've found a way to overcome it by utilizing this brain rather than pointing fingers and placing blame. I am on my rocky path to fame. Traffic jams, drunk drivers, they're all a part of the game. At times I feel as if I'm at the edge of glory, but I'll always carry the Olympic flame. I stand up for what I believe in. I believe in you, me, and we. Yeah, we all will win. Let's worry about our future rather than the red woman's BBM pin. You know what? Knowing that neither of us are perfect makes me grin. We're socially equal, yet you act like you're superior. Look beyond those fronts and into your interior. I see a weak lamb waiting for healing, and I see your pain, and I get that feeling that together as young people we can rise up and make Guyana the prize of the Caribbean. We're young, wild, and free, with that one gift to be who we want to be. So let's be we. Let's come together collectively and strive for love, happiness, and peace. On this journey we call life, it's strange and even harder to accept anything that comes differently. So let's be the future that starts right here presently, and let's create a community for all of we. So we can strive to build nations that can keep young people engaged meaningfully. I'm young and there's a lot that I want to be and a lot of change that I hope we can rally around collectively. I don't mind being on the forefront of advocacy, even if it means that I'll destroy every other possibility of me working for a government that does not see what the issues are that are affecting we. Young people are out there contracting HIV and other STDs are spreading rapidly, and almost 1 in every 5 young couple will fall into that category, that one where young people lose their youth because of teenage pregnancy. But luckily for we, GRPA is filling that gap, you see. We need to educate young people about their sex and sexuality, hoping that it will eventually change our supposedly wayward mentality, and we can get to show policymakers that they can engage us intellectually. And though we may receive a lot of opposition, champions for this cause we will always be. So it's no longer still I rise, but it's still we rise because it affects all of we. Thank you. Thank you very much. I'd just like to introduce the First Lady. It's indeed a privilege. So Her Excellency Sandra Granger was born and raised right here in Georgetown, where she began her academic journey at the Sacred Heart Primary School. Upon completion of her primary school education, she was awarded a place at St. Joseph's High School. She then went to pursue her tertiary education at the University of Guyana, where she acquired 2 bachelor's degrees, one in Portuguese and the other in English literature. The First Lady was awarded the LASPAU Fulbright Scholarship to the University of Pittsburgh in Pennsylvania, where she graduated with a master's degree in Brazilian literature and a graduate certificate in Latin American studies. Her Excellency Sandra Granger has a comprehensive work career. She worked at the University of Guyana first as a lecturer in the Modern Languages Department before being promoted to the Assistant Dean, Faculty of Arts. Her Excellency also worked at the CARICOM Secretariat for many years. Over those years, she held up many portfolios, but the most notable one was the Program Manager for Conference Services, which was her final portfolio before she retired. Aside from her professional career, our First Lady is committed to women's and children's rights, and she's currently engaged in projects geared at improving educational opportunities for children and young people, and workshops aimed at improving women's self-reliance and success in business. She believes that senior citizens should be respected, and she promotes intergenerational interactions through programs pairing adolescent mothers with senior citizens. Our First Lady is also a member of the CARICOM First Ladies Roundtable on reducing adolescent pregnancies in the Caribbean. She's also been partnering with non-governmental bodies like the Ghana Responsible Parenthood Association and Women Across Differences, working towards the reintegration of adolescent mothers in the education system and their social and economic development. Her Excellency is a patron to the Guyana Foundation, Women Across Differences, the Step by Step Foundation, and the Girls Guide Girl Scout movement. Her Excellency is married to Brigadier David Arthur Granger, President of the Cooperative Republic of Guyana. The picturesque duo has 2 beautiful daughters and 4 grandchildren. So join me in welcoming our First Lady.
Thank you. Please be seated. The beauty of coming at the end of the speaking order is that a lot of what you hope to say has been said before, but I will try not to bore you with too much. Madam Chair, Dr. Edward Green, UNSG Special Envoy for the Caribbean on HIV, Ms. Patrice Lafleur, Liaison Officer of the United Nations Population Fund in Guyana, Ms. Donna Christensen, Gilead Rep, and as Dr. Green mentioned, former U.S. Congresswoman for the U.S. Virgin Islands, I believe it was, representative of the International Planned Parenthood Federation, executive directors and president of Planned Parenthood Associations of the Anglophone Caribbean, distinguished guests, participants, members of the media, ladies and gentlemen. I feel very privileged to have been invited to join the eminent speakers at this opening ceremony for this advocacy workshop this morning, and to speak to you on an issue of fundamental human rights. For the issues you will be discussing today and advocating here in Guyana and throughout the Anglophone Caribbean pertain directly to the rights to which each human being is entitled, regardless of race, age, gender, creed, or social class. The Universal Declaration of Human Rights, signed over 60 years ago by states members of the United Nations, asserts at the very beginning, Article 1, all human beings are born free and equal in dignity and rights. They are endowed with reason and conscience and should act towards one another in a spirit of brotherhood. Article 2 begins, everyone is entitled to all the rights and freedoms set forth in this declaration without distinction of any kind, such as race, color, sex, language, religion, political or other opinion, national or social origin, property, birth, or other status. And I leave Article 2 and go on to Article 3, which succinctly states, everyone has the right to life, liberty, and security of person. Further, Article 7 states, quote, all are equal before the law and are entitled without any discrimination to equal protection of the law. All are entitled to equal protection against any discrimination in violation of this declaration and against any incitement to such discrimination, end of quote. I have quoted these articles for a reason, that being that we as humans have striven to attain laudable objectives but are constantly stymied or constrained by personal or group perceptions of morality and what is believed to be, quote, proper human behavior. For I believe that if we as individuals adhere to the tenets of that Universal Declaration of Human Rights, we would not have needed to sign and ratify a raft of conventions, protocols, and agreements in the succeeding decades, which are yet to secure for individuals in some countries the rights to which they are entitled, including, for example, access to information and services relating to sexual and reproductive rights, prevention and treatment of HIV and AIDS, youth empowerment, and gender equality. The fact is that our growth and development as a society are stunted when the dominant group seeks to impose its will and its views on another. That is why we need this advocacy workshop. When they established the Caribbean Coalition of Sexual and Reproductive Health and Rights late last year, the Family Planning Associations of the Caribbean and their partner organizations, the International Planned Parenthood Federation, the Pan American Health Organization, and the United Nations Population Fund, recognized the physical and psychological damage being done to our citizens, particularly when their right to the healthy expression of their sexuality is infringed. The program for this advocacy workshop states, and I quote, "The main purpose of this coalition is to advocate for the sexual and reproductive health and rights in the Caribbean. The coalition has a major focus on adolescents' health and rights and works to enable their access to sexual and reproductive health services, education, information, and rights," unquote. The establishment of this coalition is therefore timely, given the bleak statistics for the Caribbean in this regard. As was quoted before, our region ranks second to sub-Saharan Africa in the number of teen pregnancies. A recent World Health Organization Global School-Based Student Health Survey revealed that in our part of the world, 56% of girls and 79% of boys had sex before they reached the age of 14. Over half of the young people who had sex indicated that their sexual debut occurred before they had reached 16 years of age. The World Bank report for 2012 indicated that the adolescent birth rate, that is, the birth rate for girls aged 15 to 19 years old for the Caribbean, was comparable to those of less developed countries, with the Turks and Caicos Islands having the lowest, 26 per 1,000 women, and Guyana the highest, at 95 per 1,000 women. The adolescent birth rate is also higher than that of the general population, with a proportionately high number having at least one pregnancy before the age of 19. Deaths related to pregnancy and childbirth are among the leading causes of death among 15 to 19-year-olds in Latin America and the Caribbean. When we add to this mix young girls who may become pregnant because of rape or incest or being trafficked, we begin to understand the complexity of addressing issues relating to adolescent sexual and reproductive health and rights. It underscores the need for qualified persons to teach comprehensive health and family life education in our schools on a sustained basis, so that our children can be educated to understand sexuality and to make informed decisions, even in the grip of raging hormones. HFLE would help them to become adults who are good partners, good parents, and good sexual beings. It would also help them to understand why some of us have a different sexual orientation and to respect that difference. An issue which I would urge the participants of this workshop to address in this context is how you educate out-of-school youth who may be both illiterate and innumerate. These may include young people who dropped out of school for economic reasons, unemployed young men, young people bullied or ridiculed because of their sexual orientation, and teenage mothers who were forced to drop out of school when they become pregnant. What medium and what message will you devise to educate them to understand their sexuality? How will you assist them to grasp the importance of their sexual and reproductive health and to recognize and demand their rights? At the regional level, the Caribbean Communities Council for Human and Social Development, COSAD, approved 3 years ago in 2014 an integrated strategic framework for the reduction of adolescent pregnancy in the Caribbean. At the sub-regional level, and has been mentioned before, members of the Organization of Eastern Caribbean States have for some time been considering a draft OECS Reproductive Health Care and Services Bill. The coalition must be praised for pushing for the implementation of the CARICOM Integrated Strategic Framework and the adoption of the draft OECS bill, since these instruments will expand legislative protections for our adolescents. They may also help to lower the high rate of teenage pregnancy in our region. At the national level, we must commend the Ministry of Public Health and its dedicated health professionals here in Guyana for launching teen support groups at health centers, with, I believe, 18 such groups rolled out initially in various administrative regions throughout the country. They invite teen parents, boys and girls, to learn about parenting, to care for their health and the health of their babies. They explain to them the need to avoid repeat pregnancies and provide them with contraceptives if they so desire. And of course, they monitor the health of the babies and their mothers, as would happen in any clinic, but on specially designated adolescent clinic days. We must also commend Republic Bank for sponsoring the program for teenage mothers conducted by the non-governmental organization Women Across Differences, which bears similarity to the ministry's teen support group in that it teaches young mothers parenting skills. But it also teaches them life skills, trains them in craft and other vocations, and encourages them to become educated in whatever field they choose. The Domestic Violence Unit and the Counter-Trafficking in Persons Unit of the Ministry of Social Protection, the Guyana Responsible Parenthood Association, the Guyana Women's Minors Association, Help and Shelter, faith-based groups, and other public and private sector entities, non-governmental organizations, and community groups, to name a few, play a meaningful role in the protection of our children and their rights. Our laws and regulations need to be examined and modified so that there would be no disconnect between the age of consent and the age at which a young person can access contraceptives. We're all singing from the same page, you see. Laws which have been enacted in relation to rape, trafficking in persons, and domestic violence must be enforced, since these behaviors not only deprive the victims of their human rights, but also their sexual and reproductive health and rights. Our school's curricula must ensure a holistic approach to health and family life education. No longer should a 14-year-old girl be berated and chased out of a health center because she inquired about contraception. No longer would teenage mothers be criticized and ostracized. No longer would persons infected by HIV and AIDS or persons of different sexual orientation be stigmatized or discriminated against. Our youth comprise a half of our region's population. Their health and well-being are integral to the growth and development of the small states which comprise our community. I would suggest, therefore, that among its objectives, the coalition should not only seek to link its, and I quote, membership and governmental bodies in efforts to enhance advocacy for sexual and reproductive health and rights, unquote, but engage the entire society at all levels and across all spectra to achieve its stated objectives. With these few words, I wish you fruitful discussions and a successful advocacy workshop as you consider the strengthening of your coalition's advocacy initiatives. Thank you.
seated. Thank you very much, First Lady, for that profound address, one that is surely, quite inspiring, energizing, and it has given us a lot of food for our workshop here. Well, thank you for your support and for really championing this cause in Guyana and the Caribbean as a whole. We are very happy that you, the First Lady of Guyana, is taking a leading role, and we do look forward to working with you. And as you said, it's not only about working with mainstream institutions, but very critically that all, partners, the whole society must be involved. So thank you, and we do look forward to continued working with you. At this point, we have a special moment, one where we are saying appreciation, honoring someone who has played a significant role in the work on sexual and reproductive health and rights in the Caribbean. First Lady, ladies and gentlemen all, it's my pleasure and honor to say thank you on behalf of the Coalition on Sexual and Reproductive Health and Rights in the Caribbean to a woman of distinction, beauty, warmth, and steadfastness to the advancement of gender equality and sexual and reproductive health and rights, a Guyanese sister whom I have known for over 2 decades, a woman of faith and a women's rights advocate and activist also. Those were the days. The woman of the moment is no other than our sister Patrice LaFleur. I'd like to invite the GRPA Programs Director, Shalona Providence, to join me in assisting me with this small act of appreciation. So Patrice, you've heard she was introduced, so you have a bit of her already in the program, some information. She hails from I still don't know why, the ancient county of Berbice, and if it's still ancient, given the Guyanese context, and from New Amsterdam, that is the east, located on the east of Guyana, and Patrice is a mother of a wonderful daughter, and she has a delightful grandson, with whom she will soon be enjoying much more time and be able to offer more of herself, or so she thinks at the moment. Why? Because of this sweet retirement. Patrice is retiring, as we heard, after 30 years of service to the UNFPA and quite a lot more years of service where she has served in many capacities in both the government, non-government, and international institutions. And may I add that she once served as Vice President of the Guyana Responsible Parenthood Association. And I'm thinking that we will be seeing, a lot more of Patrice soon to come. Patrice has been a social development